to me. Before that, I would like to thank the organizing committee for inviting me to speak at this 10th Diabetes and Ramadan International Alliance Virtual Congress 2022. And the topic that has been given to me is on fasting in the child and adolescent. What I'm going to cover today is basically on the prerequisite criteria for fasting in this group of children and how to manage fasting in Ramadan, what is known and what is new, together with the nutritional care, as well as the insulin regimen and blood glucose monitoring. So let us go back to the International Society for Pediatric and Adolescent Diabetes guidelines that was published in 2019 on the fasting during Ramadan by young people with diabetes. This paper was led by Professor Asmadeep from UAE, and in this guideline, we understand that Ramadan fasting is obligatory for all healthy adolescents and adults, but individuals with illnesses are exempted if they feel fasting is going to adversely affect their health. However, so we all know many individuals with diabetes choose to fast, and the group that is exempted from fasting includes the pre-pubertal children as well as individuals with chronic illnesses in whom fasting may be detrimental to health. And at that point in time, or until now, we still categorize type 1 diabetes as the very high risk. Now let us look at the criteria for us as the healthcare provider to allow children and adolescents to fast during Ramadan. And from this respect guidelines, we actually put in that for those children and adolescents with diabetes, they may fast during Ramadan, provided they fulfill certain criteria, which include they have a reasonable glycemic control, good hypoglycemic awareness, as well as willing to frequently monitor their blood glucose levels during the fasting. In 2017, IDF, together with Dar International Alliance, actually put out that patients with type 1 diabetes who have these following conditions, they must not fast. And these include history of recurrent hypoglycemia, hypoglycemia unawareness, poor diabetes control, brittle diabetes, non-compliance to medical treatment, as well as unwilling or unable to monitor and manage their blood glucose levels. However, in year 2021, IDF, together with DAR, came up with a new guidelines, practical guidelines in 2021, which looked into the risk stratifications for persons with type 1 diabetes who wish to fast. And these people should include those who are, this criteria, this risk stratification should be done individually and is dependent on different factors. And this include pre-Ramadan glucose control, the duration of type 1 diabetes, hypoglycemia risk, level of hypoglycemia awareness, the level of diabetes-related education that these children or their parents may have had, motivation for self-monitoring of blood glucose, as well as the ability to take appropriate decision-making, the feasibility of and access to continuous glucose monitoring and advanced insulin delivery technology, together with the presence of diabetes-related complications that they may have. All right. So when they look into further, the guidelines further put in the criteria for one to actually fast during Ramadan. And this include looking at the glycemic control. For those who were considered to have poor glycemic control, HbA1c more than 9%, or have a wide glucose fluctuations, this group of children has to be, the insulin regimen has to be adjusted and re-evaluated before the start of the fasting month itself. And for those individuals with type 1 diabetes, regardless of their age, and their carers or guardians should be taught about the potential adverse effect of fasting, including hypoglycemia, and dehydration, and appropriate preventive measures need to be taken to minimize the risk of this from occurring. The other thing to look at is the nutritional assessment. We need to review the carbohydrate intake and the recommendation about the proper food options. The carbohydrate counting technique is very important to be discussed, and to emphasize on the importance of a scheduled time for meals rather than following a looser, erratic and frequent eating pattern, especially at night during the fasting month. They also need to understand that they have to take adequate intake of sugar-free beverage, especially with the pre-dawn meal. The other thing that we'll look into is the insulin regimen during fasting. So if in those children who are taking the multiple daily insulin basal bolus injections, basal insulin dose need to be reduced by 10 to 30%, and an individualized regimen should be considered and based on a review of the individual's glucose profile. Blood glucose testing in terms of frequency needs to be emphasized as well. So frequent glucose testing is fundamental, and the use of CGM or FGM, which is the intermittent glucose monitoring, is superior to the traditional blood glucose monitoring and should be the method of choice if available. And the most important thing is the fasting should be broken immediately with hypoglycemia if the blood sugar is below 4 millimoles per liter in individuals using the multiple dose insulin, both symptomatic or asymptomatic. For those using the insulin infusion, they may try to suspend the pump if the glucose drops below 5, but should also break the fast if the glucose is less than 3.9 millimoles per liter. So how do we manage them during fasting months? So what is known now is that fasting in children and adolescents with type 1 diabetes carries a high risk, and insulin analogs are better than the conventional NPH insulin or the regular twice daily regimen. Insulin pumps are beneficial in fasting, and education, as we all know, is still not available to many people with type 1 diabetes, both in adolescents and in adults. So what is new is that we now know that risk associated with fasting is not the same for all people with type 1 diabetes, especially in children and adolescents, even in adults. So some people with type 1 diabetes may have a lower risk and can safely fast if certain needs are met. Fasting attitudes and outcomes vary considerably among different countries, and CGM can aid safe fasting, and sensor-augmented pumps have allowed individuals to fast almost, if not the whole month. I will not go into detail on this because we do have some talks after my talk on CGM as well as pumps. So it is also important for us to look at the pre-Ramadan counseling. So children and adolescents with type 1 diabetes who want to fast during Ramadan should receive a pre-Ramadan counseling and diabetes education. During this counseling, a number of things needs to be addressed that include insulin type and action, glucose monitoring, nutrition, physical activity, sick day and hypoglycemia, as well as recognition and treatment of hypoglycemia. The education should be directed to both the young person and his or her family by experts in diabetes management for this age group. So this is just to share with you what my team had done during last year to help these children to go through Ramadan safely. We prepared pamphlets in both Bahasa Malaysia and English. We also have the counseling session and teaching sessions online because of the MCO. But to give you a perspective that this is something that we should be doing all along and should be doing in years to come to help our diabetes children and adolescents fast safely during Ramadan. We also need to look into the nutritional care and the meal planning. We need to look into the fact that during Ramadan, a number of our children and adolescents tend to take high fat and sugar, and this needs to be looked into. They need to lower their saturated fat and sugar intake. We also need to look at the pre-dawn meal, which is eaten as close to dawn as possible. Lean protein and carbohydrates, low on the glycemic index should be there, particularly important at the pre-dawn meal to enhance satiety during the day. Proper distribution of fluid intake during the non-fasting hours should be maintained because this is important so that they do not have the habit of binging large amounts just before dawn. The other thing that we have to look into is, as I mentioned earlier, the carbohydrate counting. This is important, especially for those who are on the multiple dose of insulin per day. And for those who are on twice daily insulin, daily consistency in carbohydrate intake at iftar and sahur is very necessary. Continual snacking overnight should be discouraged, and preprandial bolus insulin is preferable compared to the administration during or after the meal. Frequent SMBG is very important as well, and a moderation in traditional sweet intake and fried foods are strongly recommended. And the use of extended bolus delivered by an insulin pump should be used, especially over the next, if the food that they're taking is over the next 2 to 6 hours. So what we want to do is basically to try and mimic this form of insulin injections, whereby you need to give the long-acting insulin just after the fasting, as well as the use of all this rapid-acting insulin during the meal time. So let us look at what is the recommended regime by the IDF and DAR in 2021. If we look at the multiple daily insulin injections or basal bolus injections, for basal itself, for those with HbA1c less than 7.5%, there is a need to reduce the dose for about 20 to 30%. For those with poor glycemic control, HbA1c more than 7.5%, basal insulin can be kept the same. What about the prandial insulin? The patients continue to use the ICR and ISF corrections. And for those who are on fixed dose, there is no change at iftar, but to reduce at sahur by about 20 to 30%. And IDF-DR also mentioned that the use of conventional regimens is discouraged in individuals with type 1 diabetes who fast during Ramadan. However, if this is the only conceivable option, then adjustment should be carried out, as you can see on the right side here. I won't go into detail on the different kind of ways to do this because it will take a longer time, but suffice to say, this is mainly to make sure that the patients are safe during their fasting day. This is what has been shared by ISPEC in 2019. ISPEC look at the schematic adjustment on the insulin dose and or the food consideration during fasting hour. Basically, what ISPEC does is, if you were to see the blood glucose to be in a normal range, high range, or even low, between the different timing of the day, there is something that you need to do. It's something that you need to consider in terms of the insulin dose the next day, or even the food that you take the next day. So we have actually put it into 6 a.m. to 9 a.m., between 9 a.m. to 12 p.m., and at around 12 p.m. itself, together with between 14 to 18 p.m. So basal bolus regimen is preferred over conventional twice daily, and basal insulin should be adjusted according to fasting blood glucose levels. And bolus insulin before iftar and sahur using ICR and ISF-based corrections are recommended. Premixed insulin regimens are incompatible with safe fasting and should be discouraged. What about the use of the insulin infusion? For those who are on insulin infusion, it is recommended that the basal should be reduced by 20 to 35% in the last 4 to 5 hours before iftar and increased by about 10 to 30% after iftar up to the midnight. For bolus insulin, prandial insulin bolus is calculated based on the usual ICR and also the ISF. KSII on insulin infusion can be used safely and effectively in Ramadan. An individualized approach is essential for treatment adjustment, and low glucose suspend as well as predictive low glucose suspend system can reduce both the severity and duration of hypoglycemia. So IDF, they are actually mentioned at the end of that guideline for type 1 diabetes that one needs to break the fast if the blood glucose is below 70 milligram per deciliter or 3.9 millimole per liter, or the blood glucose is more than 300 milligram per deciliter or more than 16.7 millimole per liter. Or if they do have symptoms of hypoglycemia, or acute illness. So ladies and gentlemen, in summary, type 1 diabetes is a chronic disease that requires lifelong use of insulin. A good number of children and adolescents fast during Ramadan, despite being in the high risk group, and hypoglycemia awareness and hypoglycemia is the limiting factor in managing type 1 diabetes during fasting. Pre-Ramadan counseling and education on insulin type and also blood sugar is needed before Ramadan itself, and conventional regimens is discouraged in individuals with type 1 who wants to fast during Ramadan and to break the fast if blood glucose is less than 3.9 or more than 16.7, or if they have symptomatic hypoglycemia. Thank you very much for your attention.